What is your opinion about looking younger or having an attractive young face?
Well, actually, there are a few points which make people look young and beautiful at the same time, and these are to have a kind of like a V-shaped face and also to be defined, to be sharp. We are having three arches of the face, like the lower, middle, and upper arches. If you can keep these arches sharp and defined, you will look young and you will look beautiful. Very simple.
Okay. So we hear about the method deep plane facelift a lot recently. What is the difference of this method from the other methods, and does this allow staying younger longer?
Yeah, well, I mean, first of all, we have to understand why we start looking older in time after the age of, let's say, 35. And the answer is very simple. And the reason is because our bones are shrinking, and while these like three bone arches shrinking, the ligaments of the face become loose and they sag down. Now, there are two different ways of dealing with that. Either you have to reinforce these like shrinking bones, and that can happen only by taking your own fat and inject them to your face, so make the bones defined again, and then you can achieve youth or a young looking face by doing like a very simple kind of like a mini facelift. Or if the bones are structurally strong and if the patient is really old, then you have to really go in deep and then lift the whole face up in this fashion. So it depends really very much on the patient's face. If the chin and the mid face are already shrinking, then I would rather do a mini facelift and fat transfer or stem cell transfers together, where I can define the bones and then do a mini facelift in a very, very short time with a very long lasting result. Or if the patient is like quite old and she doesn't or he doesn't need any fat transfer, then I would do a deep plane facelift. The deep plane facelift has the disadvantage of like being a very long operation and being or having a kind of like a longer downtime. So if a mini facelift gets okay in 2 weeks time, a deep plane facelift takes a month to look normal. And from the longevity perspective, we don't really see any difference. So both operations last roughly 10 years, and in 10 years time probably the patient would need either touch-up or a secondary facelift.
So how do you make deep plane facelift? What is Dr. Tunç Tiryaki approach on that?
As I say, like if the patient needs deep plane facelift, then I incorporate three different parts of the face together. So I would rather start from the top. I would lift the mid face and the neck at the same time. I would open the skin, then instead of like pulling the muscles back to their origins, I would go deeper down all the way to the bones and nerve level, and then I would lift the whole ligamental system upwards. So that's my approach. Whereas if the patient doesn't need such an extensive surgery, I would skip the upper parts. I would do a mini facelift and neck lift together with fat transfer, and I would get similar results in, I would say, 1.5 hours.
Mm-hmm. Where and how do you make surgical facelift operations? Do you make the deep plane facelift in London?
Yeah, I mean, I operate in Istanbul and in London in alternative weeks, and I do a facelift in both cities, yes.
So what are your last words and recommendations for a patient?
Well, I mean, it's very much depends on what you want to achieve. If you want to have beautification and like rather changing your face, and you don't need any fat transfer, I would go for the deep plane facelift pathway. Whereas if you feel that your chin is getting smaller, you're losing the support of your cheekbones, then I would rather take the fat transfer in mini facelift pathways.
Thank you.